Welcome back to the Make a Baby podcast. I'm super excited that you're here. We are talking about all things related to basal body temperature and cervical mucus, and we have a special guest. Her name is Dr. Erin Ellis. Uh, Erin, thank you so much for being here. Thank you so much for sharing your time with us, and we're super excited to learn from you.
Thank you for having me. I'm excited to provide some education here.
So I help women heal their emotional blockages in their womb so they can go on to conceive. Now, there is so much about that I have found a lot of women don't know about preparing and knowing your cycle better. And I think we did a whole series last month inside our membership on how not to hate your period, how not to hate your cycle. And a lot of women were sharing that, how difficult it is to know your cycle.
Mm.
And or even they weren't aware like about the cervical mucus and things like that. So can you share and the best ways to know your cycle? Are they the BBT? Is it cervical mucus? Can you share that?
Yeah, I love speaking about the menstrual cycle, and it really is a beautiful process if we understand what happens during it. However, we were never really given as women like education around it, right?
Right.
Our periods are kind of like an elephant in the room, but like I said, it's a beautiful process and it's a huge component, obviously, for conception. So when we talk about fertility, I mean the highlight of the menstrual cycle is ovulation. And if we ovulate, we're going to make progesterone, and progesterone is what makes the endometrial lining really thick and sustainable to have a successful pregnancy. If you don't ovulate, you don't make progesterone, and that's where we see a lot of nuances with cycles, maybe irregularities, continuous bleeding, a lot of PMS symptoms, things like that. So ovulation really is the key to our menstrual cycle, and I think like the biggest component of it. Whether or not you're trying to make a baby, it's, progesterone is a very, very important hormone for us women. So if you don't ovulate, we don't make it. But when we're looking at fertility, we also want to, track to see if we are ovulating. And in a typical menstrual cycle, on an average, is anywhere from 26, 28 to 32 days. But when we're talking about regularity, we want to make sure that it's regular for you. So we don't want to have, a 26-day cycle one month, and then a 33-day cycle another month, and then maybe 27, 26, 42. Like it should be consistent, give or take a day or two for your specific body. So if you're having, long and short cycles all over the place, there's definitely some hormone imbalance. But typically in the middle of the cycle, on a regular 28-day cycle, we'll use that as our example here, we typically ovulate between days 14 and 16. Now, again, every body is different. So that's why it's super important to track. Day one, maybe we're going to talk about basal body temperature and cervical mucus. So you can track that to see, when you ovulate. So basal body temperature is really, it identifies ovulation. So it's when your temperature increases about 0.4 degrees over 48 hours. So it's a 48-hour time span that will stay, constant at that temperature for at least 3 days. That will likely indicate ovulation. Now, I don't like just going off, BBTs or just going off cervical mucus, or maybe just going off LH and FSH strips. We want to kind of do all of the things, because
Okay.
then you're going to get some really good data, and you want to track it, multiple cycles, 2, 3, 4 months. And that way you become really familiar with your fertile window. So you are most likely to become pregnant 4 days before and 1 day after ovulation. So why 4 days or 4 days before is because the sperm is viable inside the female body for 5 days. And the egg that we drop for ovulation is viable for 1 day. So that's how we get that window of fertility or fertile window.
Mm.
So if you identify when we have that increase in basal body temperature, 0.4 degrees, then you can, kind of assume that you're about to ovulate. Then we also want to look for cervical mucus. So this can change throughout our menstrual cycle based on our hormone levels and where we are with ovulation. So before we ovulate, cervical mucus is usually dry, maybe pasty. It could be cloudy or yellow. During ovulation, though, it's more wet, it's stretchy, slippery. It's very, very similar to egg white consistency. So this is when you are most fertile, and this is known as like the slippery days. So that's when you know, like, okay, it's go time here, likely ovulating or about to ovulate. And then you can even, track that data with your BBT to see if you've got that increase in temperature, and that most definitely would indicate that you're fertile. After we ovulate, the cervical mucus becomes really, really thick and dry. It might be a little bit cloudy, even kind of like a glue-like substance. And then right before we start our menstrual cycle, the cervical mucus is a little bit drier, or you might not have any discharge. So discharge for a woman is normal based on what I just said. Now, if you're getting like weird colors like green or yellow or anything like that, it's a sign that we might have an infection going on. So definitely go get that evaluated. So we're looking for that rise in the BBT, and we're also looking for changes in cervical mucus. If you wanted to take it a step further, you can get ovulation predictor kits, which are little strips that you can purchase on Amazon or really at they're very easily found over the counter. OPK is the abbreviation, so you can just Google that and find some. And that's when you wake up every morning and you go pee on sticks, and you're looking again for a surge in LH, luteinizing hormone. That's another sign that we're about to ovulate, and ovulation is there. So it's go time. So I really like those three things, two minimum: basal body temperature and cervical mucus. And if you wanted to add in the LH FSH surge, that would be great. Now, you're probably wondering, well, how do I do that? How do I track my BBT? Like, I just take it my temperature. You can take your temperature. That might become like pretty redundant, or oh shoot, I forgot to take it, because we really want to try and take it at the same time every morning. So at least 30 minutes, before, within 30 minutes of your average wake up time. And you can also use devices. So there's tons of devices out there that can help support BBT without you even thinking about it. So Natural Cycles is a really popular one. I have the Aura Ring, and the Aura Ring is synced with Natural Cycles. So I don't even have to think about BBT or ovulation or any of that, because the ring does it for me. I wear it all the time while I sleep, and it tracks my temperature every day in Natural Cycles. So it'll give me a rough estimate of when I'm ovulating. And I have to say, it's pretty darn spot on. But I also can tell when I ovulate as well. And then there's
Can
also
I
other
ask
device.
you a question?
Yeah.
Is that easily shared with your provider? Like, can you share that with your provider?
Yeah. I mean, I
Because
ask women.
I don't have that ring. I'm just now seeing it's becoming very popular, or it has been
Mhm.
popular. So, like, is that data easily shared with your doctor, or
Oh,
can you
yeah.
and would your doctor wanna receive that information?
Would they want to? Oh, I'm
Yeah.
sure they would, to see if there's trends in the ovulation. So there's ways that you can download. I believe you can download your report in Natural Cycles, or even if you're at your appointment, just pull up your app and share it with your provider. It's pretty spot on. And I've, not only for myself, but when I talk about fertility and people don't want to use birth control, and they want to prevent pregnancy, here we're talking about becoming pregnant, but you can do all of this too to like prevent pregnancy, because your fertile window is obviously the time that you want to avoid if you're not trying to conceive. So for me, it's like, like I said, I'm not trying to conceive, but I think the ovulatory part of the menstrual cycle is so very important for everyone, regardless if you're trying to make a baby or not. Um, so there's other devices called Temp Drop. That's another popular one, one that you can just wear a device and that will track your temperature. There's something called KEG, which you can insert every morning vaginally. It'll take your temperature, or you can just do the tried and true under the tongue, thermometer if you keep it by your bed. There's plenty of other devices out there. Again, I would try and pick something that's going to be easy for you and maybe not even have to think about it, because, you're checking your mucus. That's something that technically isn't really measured besides what you feel. And then also, the OPK strips, if you use those, you have to pee on them. So
Can
again, there's lots of devices that can make it easy for you.
I have a couple members that ask me, they currently do not have a period.
Hmm.
and it's been a long time, meaning months since they've had one. So how does how do they start to even begin to address this issue, um, if they want to approach it naturally and not take medications?
Yeah. So if you haven't had a period and you have no idea why you don't have a period, like it's not because of an ablation or birth control, I would most definitely seek medical care and get some labs tested. I've seen,
What lab should they be asking for
yeah.
if
So,
they're not informed? Like, this is coming from people who are like, "Okay, I wanna get pregnant. I haven't
mhm,
received a lot of answers from my doctor."
yeah.
And, what labs should they be asking for
So
so
a
they're
full
informed?
thyroid panel. I see a lot of thyroid dysfunction cause amenorrhea or absence of periods. So if you have a poorly managed thyroid or maybe an underactive thyroid, which is common, that can most definitely affect your menstrual cycle and just turn it off. I have a patient right now that's had no period for 2 years post birth control, and we found Hashimoto's, which is the autoimmune condition. We're also working on nutrients, very nutrient deficient. So that's another thing. Check your vitamin D, check your B vitamins at minimum, and also your LH and FSH. See if you're even ovulating. What's the ratio between the two? And you can look at estrogen, progesterone. Prolactin is another big one.
Okay.
Sometimes if we have high prolactin, that can inhibit ovulation. So those are what I would test at minimum, to see, what's going on and like, why do you not have this period? It could be anything from hormonal to the thyroid to maybe we're not eating enough or maybe we're
Okay.
overtraining too. So we have to look at all of the lifestyle. Maybe we're in a chronic state of stress, what you do is emotional work. So maybe there's some trauma related to, their
Yes.
situation and it's, cut off their menstrual cycle, from a prolonged stress response. So that's why I would look, for a naturopathic doctor like myself and or a functional medicine doctor, someone that's really going to look at the body as a whole so we can determine why, you don't have the menstrual cycle.
Can women work with you remotely or, virtually?
Yeah, so I'm only licensed in the state of Arizona. However, I can educate and consult outside. I just can't diagnose or prescribe across state lines. But I think a lot of women, from what I've experienced, they just want some answers and they just want some guidance because they're getting nowhere with their doctor. So I can provide that education and be like, all right, here you go. Here's the information you need to go back to your doctor. Because nowadays, unfortunately, we have to really advocate for ourselves and we have to go in there
100%.
and say, I want this, this, and this. And if you aren't going to do it for me, I'm going to find someone else. So, that's what we have to literally put your foot down and say, all of these things that I want. And I really hope that you can order them for me so we can get to the reason. I don't want to take medication. There's a reason why I don't have a period. There's a reason why I can't conceive. So let's figure it
Right.
out.
I have a couple other member questions. Can I ask them to
Yeah.
you? Okay, is there an ideal length for the luteal phase?
Ooh, so let's talk about the four phases. Well, I
Yeah.
consider four phases. So we
No, we
have the
talked about 4
menstrual.
phases, yeah. Go
Yeah,
for
so
it.
we have the menstrual phase, which is typically when you bleed.
Right.
In the menstrual phase is considered the follicular phases, which is on a typical 28-day cycle, the first 14 days. So we have the menstrual phase, you bleed. In there, we have the follicular phase, and then we have the ovulatory phase, which is the middle phase that we just talked about. And then we have the luteal phase. So typically the luteal phase is anywhere from 10 to 14 days. That's
Okay.
that's and that's important to know because if say your luteal phase is super duper long, that's an issue. And also if your luteal phase is super short, that's also an issue. So that tells us a lot about ovulation and why it's so important to track.
Awesome. She gave me 3 more questions.
Yeah.
If we have gotten our progesterone levels checked and they're considered normal, but our luteal phase is on the shorter side, can conception still occur?
Yeah. I mean, you could be ovulating and not making enough progesterone. That's, risky per se because we don't want to risk miscarriage. I have seen plenty of people have suboptimal progesterone levels, and we're working on the why, but yet still get pregnant. I have seen miscarry though. So that's where it's, why aren't you making enough progesterone? And it goes back to lifestyle, it goes back to nutrients, it goes back to stress, it goes back to sleep, all of those things. So yes, anything is possible. I would just make sure that one, your labs are tested. Like if you have a short, it's recommended to test progesterone specifically on cycle day 19, 20, 21 of a 28-day cycle, or 7 to 10 days post ovulation. That's going to give you the best reading of progesterone. Now, if you want to see for
I
ovulatory
love how
purposes,
specific that is. Thank you.
yeah, I would test cycle day 3 as well for LH and FSH and estrogen levels. But yeah, that's the best time to test those specific labs. If you've gone to your doctor, which I see all the time, and they just draw your hormones and they don't take into consideration where you are in your menstrual cycle, you might be deemed, everything's deemed normal. Because if you've ever looked at results for hormones, specifically estrogen and progesterone, not necessarily testosterone, but the female hormones, estrogen and progesterone, it's very dependent on where you are in your menstrual cycle and where the levels should be. So that's why it takes a practitioner to really understand that and not say it's normal, because where are you in your menstrual cycle?
No one has ever talked about that. We've talked about a little bit of testing, a little bit on hormones, but mainly on perimenopause. Okay,
Hmm.
so she has another one. If luteal phase is 12 to 13 days, but temperature drop on day 10 or 11, can conception still occur? That's the last one.
So we had this spike in temperature and then it dropped. So
Uh,
yeah, I mean, I would test again. I wouldn't just test BBT. I would look for that cervical mucus. I would make sure you have an LH surge. You can also check the position of the cervix just to make sure you did ovulate.
okay.
So again, we don't want to just go off BBT as solely as a mechanism for ovulation. And then I would also, get your hormones tested and make sure you have optimal progesterone and see
I
what those
wonder,
levels are.
I wonder, um, I wonder how many vast majority of people who go to a Western medicine doctor and it's just a random day. It's like a random Tuesday. They don't know what day of the cycle it is. Nobody asks them of concern of that, and everything is just normal. Whereas what you're explaining, you could get more explicit, deliberate results and more clues in for answers for your fertility. I was like, okay, what exactly is wrong here? Because like you
Hmm.
said, so many women are so frustrated with Western medicine because they
Hmm.
are not
Yep.
freaking getting answers. Barking that
You said
for
how many?
infinity.
I would say probably 95% don't get hormones tested on the right day, or they're
No,
getting them
I'm just
tested at
like
like,
baffled because I'm like, I bet you
oh
every
yeah.
single person I know, about probably myself, I'm about to go for my annual. So now I'm going to be like, I'm not trying
Hmm.
to conceive, but I really want to know my hormones. And I suspect that there are some issues, but now I want to know exactly where those
Yeah.
levels are. So
Yeah. So that's
now
where you have to just say, I want to get these tested on, cycle day 19, 20, 21. That's going to be the best representation for my hormones. They're still going to probably say everything's normal because it's very rare for me to see like estrogen or progesterone actually flag on labs, like say low or high, unless we're menopausal, unless we've got like a crazy amount of estrogen going on or something like that. So you could still be on the very high end of normal or the high end, and it's, deemed normal because it didn't flag and it
so
didn't
you
say
can
it was
still
high or
have
low.
PCOS and not have
Oh,
a
yeah.
period, and the hormones still be normal.
Yep. It just depends on where you are in your menstrual cycle, because if you look at lab results, it'll say like estradiol and it'll give you a number, and then right under that it'll say luteal phase, ovulation, follicular phase, pregnancy, postmenopause. So then you have to know there. But practitioners don't look at that because they're like, oh, I didn't
And
know.
what
I
if
don't
you
know where
just
you were
don't?
in your menstrual cycle.
What if you got your period like that, like 6 months ago, a year ago? So like, how many days are you in your cycle? Is that like
Yeah, so that's where
350?
we would just draw. Same with ablations or same with birth control. If you don't get a period because you had an ablation or maybe you had a partial hysterectomy, you still have your ovaries, we just draw. And you can kind of guesstimate where you are in a menstrual cycle. If you still have ovaries and you're of cycling years and you're not menopausal, I just draw and I make my best guess. Because you can still balance them. But I get really good information because most of these women that have had ablations or partial hysterectomies, they've had them because they've had crappy periods. And I'm like, well, I bet you it's because you had a lot of estrogen. Sure enough, they had a lot of estrogen. So we work on that.
Okay. You are a gift. You're floored me. Okay. Now, let me take it. Is there anything about so for women that bleed too much, can you talk about that? Because then we have the other spectrum. We had a member that bled for over a month
Oh,
and
yeah.
it was a problem and it was super painful.
Hmm.
And ended up having large fibroids in her uterus.
Yep.
Can we talk about that and what causes fibroids?
Yeah. So fibroids can be, I mean, I think honestly, most hormone, I would say most hormone imbalances are due to our environment. It's due to a lot of endocrine disruptors,
Okay.
chemicals, toxins, pesticides, these things called xenoestrogens that are influencing our estrogen levels. So typically, when I see heavy periods, painful periods, it's an imbalance between estrogen and progesterone, but it's mostly a lot of estrogen compared to progesterone, and that puts you in that estrogen dominant category. So estrogen bloats us and makes us feel poopy, whereas progesterone is more like a diuretic and will deflate us. So they're like the yin and the yang. We want a really, really good balance between the two. But our outside, like our body as women, we're very, very sensitive to outside stressors. So anything from diet to, even exercise can, influence our hormone levels. If you're exercising too much, like I said, the environmental toxins, things like that, it's all typically influencing estrogen levels. And so we see so much more estrogen, which can drive fibroids, which can drive cysts, which can drive endometriosis. We look at the gut, we look at the liver. Like there's so many different things that we have to look at rather than just saying, here, let me pull this fibroid out, give you surgery, and then let me take your ovaries out or your uterus as well, depending on where the fibroids are. Or here's birth control, that's going to fix it. No, it's not going to fix anything. We have to get to the root cause. It's like there's a reason why you have these symptoms, and it's not normal. It's not normal to bleed for a month straight. It's not normal to have to change your super plus tampon every hour because you're bleeding so heavy. It's not normal for you to not leave your house during your period because you're afraid you're going to leak everywhere. It's not, none of that is normal. So it's been normalized. That's the issue. And it might be normal for you, but it's not normal. Our period should literally come and go and be more of just like, this is annoying than anything. But anything outside of that you're having to take, pain pills by the fistful, you're vomiting, you're nauseous, you're in so much pain, you're exhausted, you can't get out of bed, you can't leave the house because you're so afraid. Like that is not normal. So there's a reason why, and we need to figure out why. And birth control in surgery is not the answer.
I am so glad you said that. I actually also had a friend who bled so long and she ended up also having fibroids. She needing a transfusion because it was
Mm,
so bad.
yeah.
Can we talk about color of menstrual blood?
Yeah.
Um,
So,
go for it.
well, a lot of women complain. I'll just say, like, what I hear a lot of women complaining is the spotting. So if you're getting like brown, blackish discharge, before or after your period, that's a sign of old endometrial lining. So is that necessarily bad? Yes and no. We don't want a lot of it. If you're getting a little bit, then that can just show that we had some sort of hormone imbalance, likely maybe the cycle before or the cycle now. But it is, to an extent, not crazy abnormal. Just depends on the amount of, you know, brownish, blackish discharge you're getting. Now, if that's all you're getting, it's a sign that you probably didn't ovulate because, like I said, the progesterone is making the endometrial lining really thick. And if you don't have implantation, you're not trying to make a baby, we're essentially shedding out that endometrial lining. And that's where we see the nice, red, bright blood. Now, if you're getting clots, that's also a sign that's not normal either. That's a sign that we have, more of probably a hormone imbalance, more of the estrogen dominant, where it's just coming out in clumps. Like if you have clots bigger than a quarter, usually a sign of too much estrogen. Um, like it goes back to the whole infection. If you're seeing like yellowish, orangish discharge, again, probably another sign of maybe you've got a little aerobic vaginitis going on, whether that's bacterial vaginosis or yeast or something like that, which is common. Usually our body can fight those off. But again, what else is influencing it? Is it the diet? Is it the lifestyle? Uh, what else? I think those are like the main ones that I guess get. And I think it's the brown blackish discharge that a lot of women are afraid of. It's not necessarily anything to be afraid of. It's just the old endometrial lining that you're shedding out that wasn't cleared the last cycle. So then we're like, well, why? If it happens once, it could just be maybe that there was some hormone imbalance going on. Every period is usually different. And if you have a one off period, we're always looking at why, what happened that last month or even the month before. Maybe you traveled, maybe you had some trauma in your life. Maybe work was super duper stressful. Maybe there's some sort of event that went on, or maybe you started like a new workout or a new treatment plan, or maybe you totally changed up your diet. Again,
Mm.
anything that's outside of consistency for the female body can shift our cycles. So we're just making sure that it's, consistent for the most part. We don't have too many one-offs where it's just all over the place and you don't even know when it's coming.
Amazing. Can you share how people can work with you and find you on social media?
Yeah, so make sure to follow me on Instagram. I'm most active over there. It's dr.erinellis on Instagram.
And remember, my friends, remember you are the miracle maker. See you on the next episode.